This is World News Today with me, Lise Doucette. We'll have the latest sport in about 15 minutes, business too. But now to India. Every year, 9 million children under the age of 5 die from treatable diseases like pneumonia, diarrhea, or the lack of a trained midwife. That's according to the charity Save the Children. In India alone, 400,000 babies will die within 24 hours of their birth because healthcare doesn't always reach those in need. Our South Asia correspondent Chris Morris now reports from Delhi.
This is a global report, but the numbers from India are particularly shocking. About 2 million children die in this country every year under the age of 5. And of that number, about 400,000 die on the very first day of their lives. And part of the tragedy, according to Save the Children, is that many of those deaths could be easily preventable if low-cost treatments for infections like pneumonia or diseases such as diarrhea were more readily available. Why are the things so bad in India? Well, it's partly a question of size, a country of more than 1 billion people, where hundreds of millions still survive on less than $2 a day. It's also the system, which in many cases simply isn't working. There are plans in place, there is money available. The Prime Minister says issues like child malnutrition and child mortality are a national shame. But for some reason, the bureaucracy isn't working. That demand to solve some of these problems isn't trickling down through the system. So for all the economic growth that India has seen over the last decade, and it is now one of the fastest growing economies in the world, it's pretty clear that India will miss by a considerable margin the target set by the United Nations for reducing child mortality by the year 2015.
Well, that was Chris Morris. Let's get more details from Delhi. We're joined by Dr. Renu Singh, Director of Policy for Save the Children in India. Welcome to World News Today. What has to be done in your mind that can solve what Chris Morris?
I think we need to take an integrated approach to looking at building a national convergent plan which will look at child mortality, in particular infant mortality and neonatal mortality, which is one of the, more than 50% of the children die in the first 28 days of their life. So I think we need to take an integrated approach to saying, how do we tackle safe deliveries? How do we make sure we tackle inequity that exists in our society, the fact that the poor cannot access health services? How do we look at gender discrimination? How do we tackle community discrimination, towards certain groups and social castes? How do we look at tackling the whole, problem of malnutrition, which is a huge problem, but which can be solved so easily if we put our minds together? Look at clean water, sanitation. How do we treat diarrhea, through making sure that children have oral rehydration packages. So I think there is a need for the various ministries to come together, Ministry of Health and Family Welfare, a Ministry of Women and Child which looks after nutrition, water sanitation, rural development, the NREGA, the National Rural Employment Guarantee Scheme that looks at social protection mechanisms. We need to all come together on the table and make sure that there is effective implementation, and there is also a whole lot of work done on community mobilization.
Well, that sounds like an awful lot to do, but it doesn't necessarily come down to resources. Bangladesh, I understand, is on the way to meeting the Millennium Goal target.
You're right, absolutely right. And the fact is that Bangladesh has not had the same kind of economic growth that India has witnessed. Yet they have been able to effectively bring down their child mortality rate, and they are on track. We are far from being on track because we need to make sure that we not only look at money, but its effective allocation of money. And also a lot of the interventions are not very expensive. This is a myth that, that it is very expensive to tackle the problem of child mortality. In fact, if we look at issues surrounding exclusive breastfeeding, which Bangladesh has done very effectively, the whole concept of making sure that there is community awareness regarding nutrition of children, the fact that they've made sure that there have been more capacity building of their health workers. all this does not cost too much of money, but I think we need to really sit down and allocate resources for this and make sure that we spend that money effectively.
Dr. Singh, thank you very much for joining us.